Hello, everyone, and welcome back to yet another edition, of my daily Rona report. For those that don't know, started doing this last week. Did it Wednesday and Thursday. Took Friday, Saturday, and Sunday off. Just had some other stuff to handle, if you will. Sunday, Friday, and Saturday, I was just took some time away, but back in action again today to bring you the daily Rona report. For those that don't know, it's just kind of quick bullet points, if you will, like a rapid fire approach to giving you updates from uh, like local and national statistics and developments for the coronavirus or COVID-19. Rhonda, she's messed everything up. So, being that I live in Richmond, Kentucky, student of Eastern Kentucky University, the local will be centered in Madison County, Kentucky, and then I'll also touch on Fayette County, Kentucky, since it's where I work, closest like large county in Kentucky to Madison County. So, uh, and then I'll get the national as well. So, Governor Bashir, or Uncle Andy, as Kentuckians like to call him, that's the majority of where the updates, developments, and things like that come from is his press conference. So every day I watch that, take notes, as you can see on my notepad here. Um, Take notes and then try to give you the quick tidbits of the important stuff from that press conference. So let's go ahead and jump right in. So first things first, we will talk about the local. So with that being said, give me a second here. So as you can see here, this is confirmed cases by county, a little map that you can get to by going to govstatus.egov.com/KY COVID-19. For those that haven't watched before, just know that any website I state will be in the description below on this YouTube video, on YouTube channel. So you can just click the description and get to any of those links through there. So this is kind of a map that you can get to by going to that website. Gives you updates. So Madison County, Kentucky, where I currently live, there are now 29 confirmed cases with one death. That's up a little bit. I know Thursday was the last time I did this. It was 23 cases on that day with one death. So 6 new cases between Thursday and now. And then try to get to Fayette County here. So Fayette now has 239 with 9 deaths. That's up a little bit as well. I believe it was I want to say 229. What is what I reported on Thursday. So that's up a little bit as well. That is the local numbers for Madison and Fayette County. So the next thing I'm going to touch on is going to be the thing that Governor Bashir starts every day on his press conference. He starts with the same thing, the top 10 steps to fighting COVID-19. So I told everyone that I would do that as well. So here are those top 10 steps. Got them up on the screen for you here. So the main one he talks about every day is being healthy at home. So leave only for essential items. Groceries, medical supplies, you need medical assistance, things like that. Obviously, go do those things, but if not, stay at home, stay healthy, avoid crowds and gatherings. Just don't go anywhere there's a crowd if you don't have to. Practice social distancing, so you want to keep at least 6 feet between you and others. Know when to seek care, so if you feel like you may have symptoms for COVID-19, then obviously call first, because there's some options they can give you to do at home so that you don't spread it. But if you need medical assistance for anything else, obviously go seek that and get the medical assistance you need. Stay up to date through reliable resources. So I named one, govstatus.egov.com/KY COVID-19. Another one, as you see there, is kycovid19.ky.gov. Make sure you stay up to date on developments, numbers, things like that. And then also wash hands and surfaces. So use soap and warm water. Want to make sure it's warm water. wash your hands for at least 20 seconds. So 20 seconds or more, get in between the fingers, all of that stuff, and then frequently disinfect regularly used surfaces. And then if you are out of work, make sure you apply for benefits, for unemployment benefits. I'm going to touch on more on that in a second with something he talked about today. And then prioritize your mental health. So stay healthy at home, but if it's warm outside, it's a nice weather, go outside and do some things that'll help give you mental stability. This is a tough time for everyone. We're used to socializing. As humans, we're social beings, so we're used to socializing, used to going places and doing things. So try to find ways to still find things that's going to make you happy while still following these guidelines. And then don't travel unless you need to, and report non-compliance. You can do that through the Kentucky Safer Hotline at 1-833-KENTUCKY or KY Safer. So another thing that Governor Beshear talked about today, as I said, was the unemployment claims. So make sure I get this number right. He talked about how all unemployment claims from March, which is over 282,000 claims, he's dedicated to having those, and the unemployment team is dedicated to having all of those processed by this week. So anybody that claimed in March for unemployment, Governor Beshear said that they should be processed by the end of this week to get those done, and everyone should be getting their money that they're entitled to. He did also say that someone placed a claim using the name Tupac Shakur, which is obviously not a real claim for the state of Kentucky, but he just talked about how doing things like that just slows down the process for people that are eligible and entitled to get those benefits. They have to weed through stuff like that before they can get to the ones that actually do deserve it. So he talked about how just you may have thought it was funny, but don't do things like that because you're just holding everyone else up. Another thing that Governor Beshear talked about was filling out the census. So you can do that. Let me pull up the infographic here. Just bear with me, sorry about that. And that's the top 10. There you go. So the filling out the census was another thing he stressed today. He did say that Kentucky is now 16th in completion, but 2% away from being in the top 10. So if 2% more of Kentucky filled it out tonight, he said that we could be in the top 10. For completion, Oldham County was in the top 10 in the nation in terms of completion percentage as of last Thursday when I reported, but they no longer are. They have fallen out of the top 10. But they're still doing pretty well. I believe it was like 71% for Oldham County, so shout out to them. But as you can see here, you can go to the website to complete the census. You can go to 2020census.gov, and that'll be down below in the description as well. So you can do, you can fill out the census. They send out paper mail that you can respond to and send it back in, or there's a phone number you can call, or you can do it online through that website. So go to 2020census.gov. It'll give you all the information you need there to fill that out. Another big thing that Governor Beshear stressed today was the regulations and guidelines for healthyatwork.ky.gov. So as we get closer to opening back up the economy, there's going to be guidelines and regulations for how we go about the new normal once things do open back up. One thing he did stress is that he wants all Kentuckians to have a mask that they can wear when they're not at home by May 11th. So he did say that the aim and the goal is to ease restrictions by May 11th and to start opening back up businesses and things like that. So it will be a phased, slow, gradual reopening, just kind of like they're doing in the healthcare, which we'll talk about in a second. But that is one thing he talked about. Make sure you get one of those masks, whether it be a cloth. He did state that, save the N95 and the surgical masks, save those for healthcare workers and people that are at higher risk, but everyone should have at least a cloth mask by May 11th. So we will now, as I said, healthcare was the first thing to open back up. So let's go ahead and I'll give you the update. I talked about this on Thursday, and we're just going to talk about it a little bit more. So this is basically the guidelines for the healthcare reopening. So as you can see, they want to stress telemedicine, telework instead of in person. So you can do something over the phone rather than in person. They prefer that, obviously. And then there will be fever and COVID-19 screening prior to enter any healthcare facility. Obviously, traditional waiting rooms, common areas, those are not going to be used. So they're going to use non-traditional options like waiting in your car, calling ahead, the register being there, and then they'll either call you to say come on in or something like that. You also, there's going to be modifications to ensure social distancing. So you want to be at least 6 feet. Physical barriers there. Then there is also an executive order available for all healthcare workers and offices and things to look at. That's available at the covid19.ky.gov. So in order to open back up, you have to be able to meet that executive order. So these are just kind of like the guidelines, but for those offices that wish to reopen and continue business, they have to meet that executive order. So go look at that if you're in that position. Make sure you're meeting that. Also, universal masking for all persons. For people, making person-to-person contact, gotta have a mask on. Enhanced sanitizing and disinfecting. Hand sanitizer stations available. Have to provide the required PPE. So everyone has to have the required PPE. And then there's no visitors except for end of life and assisting vulnerable populations. So still no visitors available. And then one thing they stressed was that all phases of this reopening are subject to delay or rollback if there's a second surge of COVID-19. So if there turns out to be, more cases, a big spike in new cases, then things could get closed back down. So you want to make sure you follow these guidelines so that doesn't happen. Then this is phase 1. This started today, as I said, this Monday, April 27th. These were the things that got reopened. So non-emergent, non-urgent outpatient healthcare services, including diagnostic and laboratory services. It includes high-touch settings such as physical therapy, chiropractic. They're going to have enhanced PPE, including gloves and eye protection for direct patient manipulation. Also talked about how places like that are high contact have to sanitize everything that either a patient touches or is used to touch a patient has to be sanitized in between patients. And then also high aerosol settings like dentistry, oral surgery, anesthesia, all those places. They have enhanced aerosol mitigation proposed by the professional associations. And they did talk about how for dental offices and things like that, you can go to dentistry.ky.gov and they have the guidelines and regulations on there for that. And this does not include non-emergent, non-urgent surgical and invasive procedures. So this, not in phase 1, those are not included. So this started today, as I said, and then beginning, if I can get it pulled up here, just bear with me. So beginning on next Wednesday, May 6th, we'll go to phase 2. If everything goes according to plan, that's going to include outpatient, ambulatory surgery, and invasive procedures. We'll resume at that point. Still going to have testing before you can enter anywhere that is open, and each facility must maintain a 14-day supply of all necessary PPE based on their projected 14-day burn rate. So burn rate is just like how much they're going to use. So they have to have PPE available, personal protective equipment available for up to 2 weeks use of what they think they're going to use. And then also type and timing of cases determined by a facility-specific procedure, prioritization, and oversight committee. So, and then for acute care hospitals, they have to maintain at least 30% of their bed capacity for in case there is a surge for COVID-19. That's both in ICU and total beds for the COVID patients that may happen from a surge. And then we will now talk about phase 3. So phase 3 of the healthcare reopening plan should begin on Wednesday, May 13th. If things go as planned, that's going to be there's not a lot changing here from phase 2. The main thing I believe that's changing is just like the non-emergent, non-urgent inpatient surgery and procedures may resume, but it's at a 50% shutdown volume. And then that's pretty much the only change from phase 2 to phase 3. And then phase 4 will be on Wednesday, May 27th, so 2 weeks between phase 3 and phase 4. So the big change for that is those non-emergent, non-urgent inpatient surgeries will resume at a volume that's determined by each facility, and then all patients, of course, still have to have the testing. You still have to have the 2 weeks of the burn rate for their PPE, and everything else will stay the same as well. So that is the healthcare reopening guidelines and phases for the state of Kentucky that Governor Beshear has issued, when you can expect those things to happen, and things like that. So next we're going to talk about the testing for Kentucky. So testing that happened in Kentucky, Governor Beshear stated that there are now 11 sites. I actually have the infographic for that as well, so give me a second here while I get that pulled up for you. So as you can see here, these are the testing sites for Kentucky for this week. These are the Kroger locations, of course. You see the 2 locations in Louisville, 2 in Lexington, and then Bowling Green and Owensboro. Those 2 locations actually start tomorrow. And then you have the rest of them there: Hazard, Hopkinsville, Cadiz, Mount Vernon, and Murray. He did say that these are all the Kroger sites which you can get to by going to. You have to register online for these sites. They're open to anyone, and you can go to thelittleclinic.com/drive-through-testing. But Governor Beshear did say that these sites are all the Kroger sites are booked through the end of this week. But they will open registration for next week starting on Wednesday. So on Wednesday, you can go register for a spot next week in one of these locations and get tested there for COVID-19. And again, that's available to anyone that wishes to be tested. There is one other testing site. So the Walgreens testing site, this one started on Friday, April 24th. You have to go to walgreens.com/coronavirus to register for it. This one's 9 a.m. to 5 p.m. 7 days a week. It's in Lexington on Executive Drive, but it's only available for healthcare workers, first responders that do or don't have symptoms. Doesn't matter if you're a healthcare worker or first responder. And then individuals who are 18 or older that do have symptoms are the only ones that can go to this Walgreens testing site. So all of those are open for testing. So another, that's basically the big developments that were talked about in Governor Beshear's press conference today. As I said, he aims to ease restrictions and start opening businesses back up May 11th. So make sure you get your mask, because he did say that if you're in public without one, and if law enforcement officials or someone see you, they're going to ask you to put one on. So you make sure you get that. It's to protect you as well as others. We don't want this COVID-19 to start spreading. We're plateauing, as Governor Beshear said, so we don't want it to start increasing again. Obviously, we have new cases every day, but the number of new cases has started to plateau. Once we start decreasing, that's when we can try to get back to normal. So we don't want things to start spiking again. So definitely follow these guidelines. Get you a mask. He said that everyone should be wearing one when they go to the grocery store or anywhere in public where they're around other people. So obviously not at home, not in your vehicle, things like that. You don't need to wear them, but in public places where you're coming into contact with other people, then you should be wearing one. So last but not least, we will talk about the numbers for Kentucky. So for Kentucky, today, Governor Beshear announced that there was 87 new cases today and one probable case for the state of Kentucky. There are now 4,146 total cases confirmed. That's 665 more than when I did this Rona report on Thursday. And there have been 48,799 people tested. That's a little bit over 6,000 more than I reported on Thursday. So that 4,146, that's only 8.5% of the total people that have been tested that have been confirmed positive with COVID-19. So although 4,000 is a lot, in terms of how many people have been tested, that's a pretty good sign that it's not more than that 8.5%. There have also been 1,281 of the cases that have been hospitalized. That's about 30.9% of the total cases have been hospitalized. There are 313 currently in the hospital. That's 9 more than the that's 11 more than the 302 that I reported on Thursday. And there are 165 currently in the ICU of that 313. There have been 1,521 people in Kentucky now that have recovered. That's up another 186 people from when I reported on Thursday, and that's 36.7% of the total cases that have recovered. So a pretty good amount there. Governor Beshear announced that there was 5 new deaths today and 1 probable death, and now there are 213 total deaths for the state of Kentucky, which is 22 more than when I reported on Thursday. And of those 213 total deaths, 99 of them come from long-term care facilities. That's up 13 from the 86 that I reported on Thursday. And that 99 out of 213, that's about 46.5% of the deaths in Kentucky have come from long-term care facilities. So obviously they're getting hit pretty hard by this virus. I talked about on Thursday how they were clamping down. You can't visit long-term care facilities unless it's, they're near death. Then loved ones can come see them, stuff like that. But other than that, you can't go in there. They're finding ways to reduce person-to-person contact between the residents in those facilities. They're also enhancing testing and doing everything they can to try to stop the spread and devastation that COVID-19 is causing to our long-term care facilities in Kentucky. So now we will talk about what's going on around the nation. So even though President Donald Trump has said some questionable things in his press conferences, at one point there was a statement, people are dying that have never died before. He's also, on Thursday, I reported about how they had found things that killed the coronavirus quicker, and President Trump then asked if there was a way to maybe put UV rays under the skin to kill people that weren't kill the coronavirus and people that were infected. He also asked if there may be a way to inject disinfectants under the skin to kill the coronavirus. So obviously those things would be detrimental to the human body, but he did issue a statement saying that it was sarcastic, then also tweeted that doing press conference would be a waste of his time. He wasn't going to do them anymore, but he still had a press conference today, so I can give you updates from that one as well. So he did state that several major cities around the country are on the decline in terms of new cases, and also stated that he wanted states to open the economy back up. He's saying that he's leaving it completely up to state governors. He wants states to open the economy back up as soon as possible, but to also do it safely. So quickly and safely was the thing that he was mainly talking about. It's a pretty short press conference, but it was the gist of what I was able to gather from it. And then the numbers for around the nation. There are now 983,848 cases in the United States, with 55,735 deaths and 110,492 people that have recovered from those over 980,000 cases. And that's reported by Johns Hopkins University. So those are the numbers, the statistics, and the developments that I have for you today. And I will see you tomorrow. Everyone, stay safe and have a great rest of your day.